What happens when you stop taking the drugs?
It's a weight loss movement that has millions shedding pounds. Ozempic and Mounjaro belong to a class of drugs originally developed to treat diabetes, but now many turning to social media to praise the drugs for weight loss.
To stop a medicine like this can result in weight regain and an increase in appetite.
And Dr. Louis Aroney of Weill Cornell says, no mystery here. That's how most medication works.
No one should be surprised by that. That's exactly what we would expect would happen if you stopped a blood pressure medicine. Your blood pressure would go up.
One other issue for those who saw significant weight loss on the drugs is a loss of muscle mass. While it's comparable with traditional diets, the speed of weight loss on drugs like Ozempic and Wegovy can be an issue.
We don't recommend that people lose weight too rapidly. Rapid weight loss has been shown to cause excess muscle mass loss.
And of course, we have our own doctor, our wonderful Dr. Jen Ashton, our medical correspondent here to break this all down. You are managing patients who are on these medications right now. So talk about that concern. What do people need to know when they get off these drugs?
Well, first of all, because I'm board certified in obesity medicine, and I think this is getting kind of a bad rap in our lay public because people think it's a trend or it's a fad. We've known that this class of medication, along with other FDA-approved weight loss medications, has worked very, very well, and it's been used off-label for almost a decade, if not longer. As we heard in the piece by Dr. Louis Aroney, this is not candy. This is not like treating strep throat. So when people come off a medication that they need to treat a chronic condition, which the conditions of overweight and obesity are, of course, rebound weight gain is possible, if not likely. So while this isn't a standard algorithm or protocol, if you will, for doctors managing patients like this, what we'll often say is, let's try to get you to your target healthy goal weight, and then basic principle of pharmacology. The best dose is the lowest dose of the medication that works. And if you need to drop the dose and then expand the frequency to taking it maybe once a month, once every other week, the key is keeping you at that healthy weight in the safest, most efficacious way we can do it.
Almost like touch-ups. How long should someone expect to be on the drug in the first place?
Well, remember, these conditions are chronic, so potentially in some way, shape, or form indefinitely, but we know that the phenomenon is set in the brain to restore your weight to its heaviest level. So this is not a matter of willpower. It's not a matter of eating less and moving more. Behavior is always important, but you have to let the pharmacology work.
Such important points. Always a pleasure, Dr. Jen Ashton. Thanks so much.